Good afternoon. My name is Edna Navarro-Vidaure, and I am the Senior Community Engagement Associate at Illinois Action for Children. On behalf of Illinois Action for Children and the Consortium for Community Systems Development, we would like to welcome you to today's exciting webinar highlighting the accomplishments and lessons learned so far from the Innovation Zones. Today, leaders from Greater East St. Louis and Williamson County will share systems alignment strategies used to increase developmental screenings and enrollment of very high needy children ages birth to 5 in high-quality early learning and developmental programs, including early intervention and special education services. Sorry about that. Today's agenda includes a brief overview of the Innovation Zones, stories from Innovation Zone leaders, a response from the Office of Early Childhood Development, and after the two presentations, Renee Tetrick, our Innovation Zone analyst, will facilitate our question and answer session where we will try our best to answer your questions. To get us started, here are some housekeeping tips. This session is being recorded and will be available later on our website for viewing. All of the participants have been muted. If you encounter technical issues, please use the chat box to send us a message about your technical issue or send an email to Maya Wilson at actforchildren.org. As each presenter shares their story, we encourage you to please use the chat box to submit your questions, which will be used for our question and answer session. At this time, I would like to introduce Leah Powell, Director of Program Innovation, who will give us a brief overview of the Innovation Zone initiative. Leah?
Hi, Edna. Thank you. My voice is a little bit raspy, just to let you know. I don't normally sound so deep. But thank you, everybody, for being here today. We're really grateful to have the opportunity to showcase some of the highlights of what's been going on in our Innovation Zones. The Innovation Zones are an initiative that's been funded through Race at the Top Early Learning Challenge Grant. Our work has been designed to help the state learn different strategies that could be very effective in helping us achieve the goal to ensure that more young children with very high needs are enrolled in high-quality early learning and development programs. We've been building capacity in each of the Innovation Zones. They've been using a systems change approach, including using tools from Able Change, including using data, action learning, the idea of starting small, changing habits, changing how we do what we do, to work and develop these different goals and test and implement strategies in one or both of the following areas. So Innovation Zones are either working to enroll and serve more very high-need priority children in high-quality programs, and they're also working to increase quality in early learning programs in their communities. We have 11 Innovation Zone communities statewide. They're in Altgeld, Riverdale community areas in Chicago, Austin, Aurora, Cicero, Elgin, Englewood, Greater East St. Louis, North Lawndale, Pilsen and Little Village, the south suburbs of Cook County, and also in Williamson County. All of the Innovation Zones are doing amazing work and have come so far in implementing and adapting their initial strategies. One thing that I wanted to add is this idea that, one thing that's really exciting, specific for today's work, is that we've been working the Innovation Zones with the pilots that they're doing and the access through their collaborations and the community work that they're doing. We've been working with the Early Intervention System as partners in their state system improvement plans. So East St. Louis, Williamson County, and Aurora have helped to be partners to help inform and to help build lasting systems change in that system. Overall, we're more powerful together. It's exciting to see the communities coming together using one common agenda to really think about all of our kids. I think there's been a habit over the years where people work a little bit in silos, not meaning to, but with systems alignment, we can come together and be stronger in the work that we're doing. We're grateful to be invited here today and to share with you some of these efforts, both where they've learned, where they've pivoted and made different shifts in the work that they're doing. And we're happy to share the early wins so far. So thank you for that. And Edna, I'll turn it back to you.
Thank you, Leah, for that introduction. Our first presenter is Janice Monster from the Greater East St. Louis Innovation Zone. As a side note, Janice will not be available during the question and answer session. However, Janice will be available to answer your questions through email, and the Innovation Zone team will try to answer your questions as best as they can during our question and answer session. Janice?
Hello, everyone. Thank you for joining the webinar today. It's so exciting to talk about the successes that we've experienced as an innovation zone here in Greater East St. Louis. The first slide that you see provides some background information about the communities that are included in Greater East St. Louis, which include the communities of East St. Louis, Washington Park, and Centerville. We have about 5 zip codes that we cover. Our geography is relatively small. We're about 10 miles by 10 miles, and our geography is the same as School District 189, East St. Louis. So during our data discovery phase, we had the opportunity to collect a lot of data, both qualitative and quantitative, to really learn more about the demographics of our community. And so what we learned from that is that there are about a little over 4,000 children in the community between the ages of birth to 5 years of age, the age that we were targeting with our Innovation Zone strategies. And about 52% of those children live in poverty or deep poverty, and we use the 100% federal poverty level as a marker. And just to give some context, with the new preschool expansion grant, the ceiling for their eligibility is 200% of federal poverty level. And in Greater East St. Louis, every single child would actually qualify for that program because every child meets that eligibility criteria for income. In the community, we had 4 programs with an Accelerate Circle of Quality. And there was really minimal cross-sector collaboration that was occurring. The collaboration that was really occurring was predominantly between child care and family child care homes with the support of the Child Care Resource and Referral Program and the collaboration in the community called the Greater East St. Louis Early Learning Partnership. We also learned that where programs, social service agencies, state agencies, child care and early learning programs were located in the west end of the community, and most of the families lived on the east end of the community. And that's really important learning for us because our transportation systems, we have one bus line that goes down a major street in the community, and we have a Metrolink mass transit that goes down one pathway through the community, and that also is not connected to where families live. So accessibility was really challenging for families to get to services, follow-up appointments, those kinds of things. The other thing we learned in regards to our children was that less than 2% of the children birth to 5 had an individualized family service plan or an individualized education plan. And 2 of our 12 child care centers were providing screenings using a research-based reliable tool. Some self-reported that they were providing screenings, but they were simply using a developmental checklist. The other thing we learned was that child find was a very unfamiliar term to many of our educators, to many of our healthcare providers, and to some of our home visiting programs. Through our data discovery phase, we also hosted lots of opportunities for data dialogues, where each agency stakeholder who came to our work had the opportunity to actually report and share their data, and then posed questions to our work group about what we could use, how we could use the information, and how we could learn from the data that they presented. We really were very conscientious about providing a safe space for people to share their information, because sometimes our data is not as positive as we would like it to be, but we really wanted to make sure that we used it as a learning time to advance our agenda and to develop strategies that could change data outcomes. And we also use it as an opportunity just for further inquiry and mapping of our programs and services. Okay, the next slide talks a little bit about the planning stages of the Innovation Zone. When we started our planning, we really desired to engage more cross-sector systems. that early learning programs were not the only programs in our community who were providing developmental screenings. DCFS, home visiting programs, preschool for all, early intervention, child care, and health. So we wanted to bring all those stakeholders to the table to talk about what is their process for screening, what is the tool that they use, do they know about reporting screening data to Child Find. So we really started out with bringing everyone together to get to know each other and to build relationships and to build trust. We also began with looking at some of the root causes of the problems. Why was less than 2% of our children being identified? You know, was it because they didn't have access to screenings? Was it because programs weren't providing screenings? Was it because screenings were happening and children weren't being referred? So we asked a lot of questions, and we went a little we dug a little deeper into some of the reasons why our data was the way it was. We also then used that data to make sure it informed our thinking, our planning, our decisions, and we've constantly used it all the time to make adaptations, to change our approach, to make some course corrections along the way. Through our planning, we also developed a work group that was dedicated to screening and outreach for Greater East St. Louis. We developed a work plan and some of the strategies to really address some of the root causes that we identified. And I'll be sharing a few of those strategies later in the presentation. We also committed as a group to continuous quality improvement. That's a strong component embedded within Accelerate, and we just thought as stakeholders we should also be modeling continuous quality improvement practices within our own work, not just in child care. So through our planning and our root cause analysis, it really helped us to dig a little deeper into the problems. And that problem statement, we found that there really was minimal evidence of a coordinated community-wide approach for developmental screening across sectors. We have about 13 different places a family can go to access a developmental screening, but each stakeholder, each system had a different process. They might have used a different tool. So we wanted to make sure that we were all following the same process, that we had consistent messaging to families when using results. We also learned that our screenings in the community were primarily administered strictly to fulfill state or federal program grant requirements, and that those met Child Find, but there wasn't coordinated community Child Find efforts going on. We found that programs that provided screenings didn't really fully understand their roles and responsibilities in regards to Child Find, because Child Find isn't written into licensing standards. It's not in the contract for Preschool for All and Prevention Initiative programs. Even though we're cited as referral sources, many of us really didn't know what that meant. What did that mean to be a Child Find referral source? We hosted several parent cafes in the community, and we learned so much from authentic parent voice about our processes, and hearing their stories about how overwhelming the special education process is, from referral to eligibility, domain meetings, consents, articulating accommodations they would like to have for their children, where services could be delivered, how do you do that in natural environments. So we learned a lot from the parents, and that the parents themselves had many strong feelings and responses to developmental screenings. There was a lot of fear and anxiety that came out during the parent cafes. Parents' fears about their children perhaps being removed from their home if their child was identified with a delay. Fear that perhaps something that they had done as a parent that contributed to the delay. Also fear that having that label on their child would create a stigma amongst within their own family, and then also their prior experience with education systems and using avoidance, that they didn't want their own child to have that same experience. So the parent cafes uncovered a lot of rich information and helped us to be much more sensitive in how we formed our messages, how we created applications, how we used 3 or 4 dot points to make sure that parents really understood when they were signing a consent to have their child screened, that they really knew and understood what that consent was giving. We also learned that in the community that our Part B and Part C systems really were operating very differently, or they were there wasn't a lot of alignment or collaboration in regards to child find efforts in the community, that we were all tracking data differently. We had different progress measurements towards state and local targets, and that transitions sometimes were very difficult in making sure that when children left an early intervention system, that they also had smooth transitions to school district or Head Start programs. And early on in our work, as we discovered that the percentage of children with an IEP or an IFSP was rather low, as a group, we made a collective decision to make a very strong and bold statement in that providing special education services in our community was not an innovation, but it really is a legal requirement, and that many times families weren't aware of their rights and responsibilities in our early education and special education processes. So we were very intentional about making sure parents had support during those processes. So through all of that work, we came together and we developed a project goal, a goal that kept us targeted and helped us to really be mindful of what is it that we were trying to achieve. And so essentially we committed to developing a community-wide systemic approach designed to increase awareness, access, and utilization of developmental screenings for children 0 to 5 years of age. So essentially, really making sure we had a coordinated, collaborative, community-wide child find efforts that were ongoing and continuous. The next slides are going to go into some of the strategies. These are just a few of the strategies that we are going to highlight. On the left are the strategies, and then on the right of the chart are some of the outputs and outcomes that we were able to achieve. So our first strategy was really to engage those those systems perspectives, and we have at the table folks from mental health, early education, and higher education, child welfare, DCFS, intact case managers, some of our home visiting programs. We are very intentional about making sure parents and families can be present. We often help to provide rides so that those families can be at the meeting and provide voice during the meeting. We've also included state leaders from ISB and DHS. And so some of the outcomes that we've been able to achieve through that strategy was really, our first step was having a cross-sector survey monkey of the 32 programs that were administering screenings. And we found out from them, you know, what were some of the challenges and barriers to families not accessing services? What perspective did they bring to their process? Was it effective? What would they like to learn? What would they like to change? What do they know? What do they want to know? So we did a lot of surveying of our programs initially. The parent cafes were also helpful in learning a lot, and during the parent cafes we also had these various systems engaged in those cafes so that they could watch and listen as well. We've worked very hard to have data transparency, and we've worked very hard at figuring out data alignment between Cornerstone, the ASQ3 enterprise account, and Child Plus, which our local Head Start uses. We brought in various state and local systems a meeting. We had Pam from ISB, gosh, can't think of her name now, Anne from DHS, StarNet, our local Child and Family Connections office, Donna from the governor's office, to really help us better understand what each other's roles were for Child Find and their responsibilities, and we're hoping that conversation will contribute to a shared document that Pam and Ann will be working on for statewide implementation. We also worked with the local interagency council so that we could develop a Child Find training for the community, and that first training, over 95 different professionals from the community, including parents, attended that training. We also had a cafe where each agency in the community hosted a table where people could learn and better support cross-referrals in our systems. We mapped out in the community all those 32 programs that were providing screenings, where to go, and what screening tool they were used. And so that's a document that parents can have and child care programs can use and hand out. We also really focused on using a strength-based screening process. And this has probably been the biggest shift in our work, that we really wanted to make sure we were celebrating what children can do, that regardless of the ASQ3 results, we wanted to celebrate progress. And there was so much to be proud of regardless of the results. And we're working on a new document that really helps those administering developmental screens, the various pathways that they can take. And we've used the constant theme of let's play and grow if you're typically developing, let's watch and rescreen if you're in the monitoring area, and refer and follow up if you have developmental concerns. So we also tried to use positive language in all the print materials that we developed. We then developed or implemented one of our strategies is to implement quarterly community-wide screenings, and we did that this summer. We partnered with the district's Preschool for All program, Head Start, the federal preschool expansion grants, More at 4, our home visiting programs, and Early Head Start. And we hosted 3 weeks of developmental screenings in the community where over 300 children were screened during that process. The screening results and the energy around coming together to develop screening, we also then said this was easy. Now let's also try this in our registration processes. So we worked on enrolling children for preschool. So in addition to screenings for children 0 to 5, we had a coordinated community-wide registration process for our preschool-aged children. We've developed universal screening forms that all of our programs now are using for consents and for messaging with families, and they're both in English and Spanish. We have a small Spanish-speaking population in our Fairmont City area. We also worked really closely with the COFI program, the Community Organizing and Family Issues Parent Ambassadors, and they were so instrumental in canvassing in the community prior to our 3 weeks of screenings. While we administered screenings, they were the greeters. So when parents arrived, they were greeted by another parent who they might have known, or they gave just comfort knowing that another parent was also present, and they just really helped us to bridge that gap or bridge the transition in relationship from professional to parent. We worked very hard in developing those messaging, and we engaged quite a few folks who were unlikely messengers. So one of the pictures on that slide is that's the chief of police. I was at a meeting, and we were talking about the developmental screenings that were going to be happening in the community, and he said, how can we help? And we had coupons that the parents actually asked that we use. It was a pay it forward coupon, so you got one and you could pass one on to the parents. And so the whole police officers during their beat handed out coupons in the community and referred them to the developmental screenings happening in the community. We've also partnered with the SIU Edwardsville's capstone students who are going to be hosting our next community-wide screening event at the Jackie Joyner Kersey Center, where we're going to be providing screenings and a family fun event. So again, it will be seen and perceived in the community as something fun and something you should and want to do. We partnered with our faith communities in Greater East St. Louis, and we wrote a document called Testament and Tots. And so faith communities could read what we had written about developmental screenings and the values and benefits of why children should be screened with their congregations. We've invested resources into the ASQ3 enterprise account, and so through that we have the family access, and we now have a postcard available to families that allows them to use their smartphone, go to a computer in the community, because computer access isn't readily available, but there are many community sites in which they can go to complete the ASQ3 online. And on the opposite side of that page is information about the Daily Vroom app. And if you're not familiar with the Daily Room app, I would highly recommend go to your iPhone or your Droid and just download the Daily Room, and you can support extended learning with children and families. So as of today, through our child care programs and the community, we've screened a little over 550 children right now. The next slide talks a little bit about how we built capacity in the community, and through that investment through the ASQ, we made sure that every child care center could have access to the ASQ3 materials. So we purchased the online kit, we purchased the materials kit, and we were fortunate to receive a grant from the Ameren, Illinois, who funded laptops for every child care center in the community. And so now all of our child care centers can screen children at their own programs with families. We also invested in a coach to make sure that as programs were screening, and this is fairly new to them, that they had support in resources and follow-up. And so one of our consultants meets with them once a month at each of our sites. And so through that, we know that that work can sustain itself even after the grant funding is gone from the innovation zone. We've worked hard to make sure whatever screening processes we developed, that they aligned very well with Accelerate, because our programs are also working hard to achieve an Accelerate circle of quality. We continue to use and collect data all the time to make sure we're making progress. We just got our update to see if we've had a change in the number of children with an IEP or an IFSP. We didn't see significant change. However, we saw one both in early intervention and one in early childhood special ed. So one additional child for each program has been added since 1 year ago. But we really think that we've not done this work long enough to really see the needle move in those efforts to date. As far as the Greater East St. Louis Innovation Zone, we've learned a lot along the way. We've discovered so much. And the first part is, the next slide, Edna, is that we've really learned and leaned on the relationships we had in the community. We re-engaged folks that weren't always active at the table. We were very transparent, and through our transparency is how we build trust, and we've been able to make progress. We've had to learn the language of the various systems. If we use the word assessment in early childhood, that means something very different than child welfare, mental health. So we had to really be mindful not to use acronyms. When folks use vocabulary words we weren't familiar with, we've asked them to expand and explain their definitions. We've worked hard on our shared data system by using the ASQ3 Enterprise. It's really been a great system to track referrals, to see how many children are following in certain areas. It's been helpful to see where children are falling behind in which domains, so that we can track and make interventions and individualize our curriculum and lesson planning. Family voice and unlikely messengers have been crucial in our work. We've learned that we have to make things easier. The language we use as educators and professionals is very different than the language our families use. And so we've really been mindful about looking at what reading level our materials are, the words that we use, are they family friendly, and do families understand them? We've really facilitated a lot of shifts, I think, both in the community and statewide, that great things can really happen here in Greater East St. Louis when we work together. So there have been some cultural shifts, some behavioral shifts, and partnering and collaborating and doing things together. And we've also shifted a lot of thinking about shared data measurement and transparency of data. Leadership has really made a difference in our work. Key leaders making sure that folks within their agency come to our meetings to plan, to implement, to share information, to bring perspectives that happen at our stakeholder meetings back to their organization. So those feedback loops have been very, very helpful to our process. We also learned early on that a screening was better than no screening. When we began this work, we thought it would be great if everybody used the same screening tool, However, many agencies and programs had made investments already in prior tools, and so some programs have shifted, and we're glad to say there are 3 tools used in the community: the DIAL, the Brigance, and the ASQ3. And now our next step is to really make sure we all understand how to interpret those results whenever a referral is made from those screening tools. We've also posed some wonderful policy and practice barriers and innovation zone policy and practice innovations to state and policy leaders. And overall, we have found that in this community, we've got to figure out a way to deal with transportation, because transportation provides access to so many needed services in our community. So that's a conversation that we want to have with our leaders in the community. There's also another group in the community called Eastside Align, which is a collective impact process happening here in the community, and so we want to make sure that transportation is on the forefront of that planning. So I'm glad to say that Greater East St. Louis has accomplished a lot. I'm sorry that I can't stay for the question and answers, but please feel free to reach out to me by phone or email, and I'd be happy to answer any of your questions and share our experience further.
Thank you so much, Janice, for sharing the Greater East St. Louis story. As a reminder, I'd like to ask our participants to please submit your questions to the chat box so that we could try to answer them during the question and answer period, or if you'd like to send them directly to Janet, she will be glad to answer them. Our second presenter is Susan Adorjan. Thank you so much, Susan, from the Williamson County Innovation Zone. Susan?
Hi, I'm Susan, and I work for the Williamson County Innovation Zone as the screening consultant. The slides that you're going to be looking at for ours give you some basic information, but I'm going to be expanding a little bit about on what they say. We found many of the same concerns as the Greater East St. Louis Innovation Zone. That were similar issues. The name of our innovation zone is Connect for Success. It is one county within the 15 southernmost counties in Illinois. To understand just how rural we are, there are about the same number of children in our entire county as are in the Greater East St. Louis Innovation Zone. These counties are within an area served by the Southern Illinois Coalition, which is a group that has a more regional focus. We have to think regionally to get things done here, and we've been very successful with this approach because our focus is on connections. We are starting with one county, Williamson County, and we're hoping to expand what we have learned as part of the Innovation Zone to the other counties in our area. Next. As you can see by these numbers, we're a poor county, and the picture is really not improving. We're rural, which means that there are many unincorporated areas not served by any community. This leads to rural and social isolation for families and children. Add problems with transportation, lack of jobs, and you can imagine how difficult it is to access services. Families may have to travel 25 miles just to get to a large town. Our innovation zone has 4 main goals and 11 innovation strategies. Next. Today we're focusing on the two goals related to screening, a countywide screening effort and a countywide collaborative. And that's listed on the slide. Getting ready. With any new initiative, you have to prepare. And we thought we were ready because the bigger coalition had been working on these problems for a while before we became an innovation zone. When I came on board to facilitate the work on the screening goals, I thought we were all on the same page based on prior conversations with the group. And as you probably know, it is often a slightly different picture when people are asked to change what they're doing. I remember my first meeting with the group, and almost every person disagreed with using the ASQ or didn't think the results would be valid. It turns out that the 2 biggest programs had decided not to use it, or we're only using it for children under age 3. It was a tough meeting. Some people were uncomfortable with sharing information in the database, so we spent a lot of time with the group getting comfortable with these changes. Large agency programs work within constraints such as bigger agency policies, inability or unwillingness to make changes, and we had different challenges with center-based programs. But we've been able to figure out how to conduct screenings in very creative ways. We all needed to be flexible. So we've persevered and have made great progress. So don't get discouraged when you're in this. You're finding some barriers initially. When it came time to get set, we discussed ways to get programs on board, and then we piloted these strategies with a few brave center-based programs. We adjusted our expectations based on feedback and experience, and then tried it with a few more. The first center had about a 20% rate of the return permission to screen forms. We were a little disappointed. The second center expected 100% participation and got it. And it was all in how the letters went out to the parents. First few programs had us and EI do the screening, and now they're all screening with their own staff. One center tried to have parents fill out the ASQ at home and return them for the teacher's perspective before finalizing the results. One program had parents fill them out and teachers fill them out and then schedule the parent conference to discuss. And when the centers had questions, they would contact us for support. So we were making a lot of phone calls. For example, we found almost no center knew how to make referrals or understood their legal obligations regarding IDEA. But we embraced their ideas so we could test different models. Now, all the center-based programs have become our research partners. And our goal is ambitious, but we're making good progress. For example, not one center used the screening data form that is usually submitted to CFC. Now they are all submitting that data. Okay, next. You can see that we are very close to our projected goal with the number of children screened this year. In a little over a year, we've identified about 50 children who need further evaluation and almost 70 children who needed to be further monitored. Like Janice's program, it's a little under 10%. Centers are using specific strategies and then re-screening the child to determine if progress has been made, and we're even seeing improvements when the child is re-screened. So that's a great success for us. The ASQ Enterprise and Family Access database has some very cool features. The ability to score the screening, print out the result pages for parents, generate reports of all the children screened, list those children needing referrals or monitoring, and scheduling the next screening. Now, we're aware that all these changes must be sustainable, so we are committed to looking at solutions that are cost and time effective. Okay, next. Collaborating is hard work. I know everyone says that, but it's true. Our group is usually on board with most of it. When we get off track or we get stuck on an issue, I pull out the agreed upon goals and strategies in our work plan and we refocus. And this has happened a couple of times. We got caught or stuck on one thing and didn't want to address maybe the more difficult things, and we just bring it up when we need to. We've been lucky that we've got people who are all committed to seeing children receive needed services. As Janice said before, we have had to learn a common language based on different perspectives. We've strengthened the relationships and we build trust between members. Next. I call the first year the year of the forms. It sometimes feels like 2 steps forward and 1 step back. We are now using a common memorandum of understanding and a common permission to screen form, which has been very helpful. And some of the forms are in duplicate and triplicate so that we can share those forms with the agencies that are collaborating with us. Listed are examples of the items we've worked on. We've worked on forms and protocols from beginning, permission to screen, all the way to referral. Centers are now directly contacting the 3 to 5 early childhood specialists within the special education provider with questions about children and screening results. We've been very lucky that we have found a person who is willing to be the contact person for the 3 to 5 referrals and is building good relationships with the centers. Okay, next. Sometimes people are just overwhelmed with all the things they are expected to do in the normal course of their jobs, and we didn't want screening to be just one of those things that had to be done. So wherever possible, we aligned the work with what is expected by other initiatives like Accelerate or the reporting requirements for Preschool for All. They have very useful examples on their website about forms that you might want to use as templates, because centers had to be comfortable that these were going to meet their requirements for their Circle of Quality. Our Child Care Resource and Referral is an authorized entity, so we were able to get registry approval for the ASQ training we developed, and there's one of the quality specialists in CCR&R who works directly with all the research partners, working closely with our screening work group, and is an ASQ trainer, so she's got lots of information and been a wonderful support. She's currently helping centers review their screening policies to meet recognized best practices. We also have staff on CCR&R who are responsible for running reports from the ASQ system and making sure data gets entered, and that's very helpful. Centers who have trouble can call them and get some assistance. And we love hearing that screening has helped in unexpected ways. Programs are now asking for permission to screen when children are newly enrolled so they can plan activities that are appropriate for the child. And they tell us that it's been save their teachers time and increases their understanding of how to plan developmentally appropriate individualized activities for their children. Okay, next. So that graphic kind of explains how I feel sometimes when I'm in a tornado. And that's what it feels like sometimes. But you got to plan, you got to do it, you got to reflect, and then you got to revise it. And sometimes that happens 3 or 4 times in one form. But that's okay. You can make it, and you can do it. Now, what I've listed here are just some changes that had to be made based on what we thought we were doing and what we ended up doing currently. And I'm sure that's going to change again because we've got our research partners who will be informing our practice for what's working for them as well. So some other things we've done are changing letters sent to parents to make them easier to read, supporting directors as they communicated results to parents with parent-friendly resources. So the EI provider and the special ed cooperative, they came up with parent-friendly letters so that if they were going to be called after a referral was made, at least they had some information. They understood that it was a law and that they were going to have some information about why this person was calling them. That has been very helpful. We would like to make screening results portable. We've been doing that between centers because we are we manage the system. So if a child goes to another center, for instance, we can transfer the screening data to the new center. But we're also working hard on trying to make that portable for parents. But we haven't figured out how to do that. So I'm still hoping that ASQ will make an app for that. Maybe we ask them enough, they will. Okay, next slide. So we've learned a lot of lessons, many similar to the lessons, as I said, that Janice's Greater East St. Louis Innovation Zone has identified. Some of these lessons we're still learning. So I am going to read these because I think these are important. So Head Start says they can't do screening prior to enrollment because it won't meet the federal requirements. So children might be screened at a Child Find event, and then after they get enrolled, maybe 2 months later, they need to be rescreened within the Head Start requirements. And that's something that we understood and we work with. Our community Child Find event, as it is in many places, is viewed as an enrollment event. So children who want to get into pre-K know they have to come to a Child Find screening. But we're not able yet to get out in the community and have it viewed by parents as a something that they should do yearly. And one of our other goals with the Innovation Zone is some more parent outreach, and they're working on that. It is sometimes difficult to agree on forms. Sometimes we've changed them 3 or 4 times. Sometimes we're arguing over a comma and a couple of words, but we finally get it done. It means you have to persevere, so don't get discouraged. Some of the reports don't meet different program requirements. So for ASQ, we can pull up a report that tells us a lot of information, but maybe it's not going to work for pre-K requirements for another project that they have to collect data for. Or Head Start has to run a report, and that is sometimes frustrating because they are currently having to enter 2 different and so that's frustrating. Sometimes high-risk children are not able to participate in half-day programs without transportation and flexible work schedules. And next. We would recommend that children who are screened within 90 days of enrollment would meet requirements so they don't have to be double screened. We are aware of and supportive of changes that might help improve the Child Find process so that data is collectible and useful, and that we're doing a better job in our communities of holding Child Find and just explaining what that really means. And of course, it would be helpful if there's some standardized required reports and forms that and I think the biggest is that you've got to have some kind of screening case management of it as a source, not just with EI, but with the whole system. And I expect we'll have more suggestions once the work is done. Okay. If you need to contact us, Lori Longville is the overall project contact. I am the screening consultant, and my email is there. And Marilyn Murray is the infant toddler consultant who's working on the screening initiative with us. Thank you for listening.
Thanks to both of the Innovation Zones for sharing your community stories. I would now like to introduce our next guest. Joanna Sue is the Community Systems Policy Director from the Governor's Office of Early Childhood Development and will share the state's reflections on the Innovation Zone work. Joanna?
Great. Thank you so much, Edna. I want to extend a special thanks to Susan and Janice and to all of the folks who worked with you all on the in the East St. Louis, Greater East St. Louis and the Williamson County Innovation Zones. Susan described the work as somewhat of a tornado, and we really appreciate all of you sticking with it. And with special thanks to Leah and her team at Illinois Action for Children, who has been sort of building this process and supporting the communities in their good work. So in listening to the very interesting presentations, the lessons learned, these are many of the things that we want to strengthen. We at the state want to strengthen within local communities, and we are really taking note of the lessons that you're learning and the processes that you've been undergoing. And so, I'm hearing a number of common themes. One is, how important it is to be able to build those cross-sector relationships and building trust. And as part of that, that means really listening to the concerns of, both providers and families, and making those voices heard. Um, Another thing that I heard was moving toward different kinds of universal screening systems, shared forms, making sure that these processes are family-friendly, family-centered, and that includes making these materials available in languages other than English. Another key piece that I heard both speakers talk about was that they're using data from the beginning to better understand the target population, the community, as well as to dig deeper and look at what are the root causes, what are the overarching issues, even looking at things like transportation that is beyond the traditional sphere of thinking about early childhood, but these are the kinds of large issues that really need to be dealt with at the community level if we're going to move the needle for children and families. So in closing, some of you who are part of the Early Learning Council's Community Systems Development Subcommittee know that at the state level we're trying to build a state system for supporting community collaborations like the innovation zones to be able to do this good work better, being able to use the data, get the data at the community level, to use it, to analyze it, and to really build strong collaborations, cross-sector groups that are able to do these kinds of coordinated supports. These are the things that we want to see more of at the community level and that we know we at the state need to do a better job of supporting. So thank you very much, and back to Edna.
Thank you, Joanna, for sharing your thoughts on the Innovation Zone work. Renee Tetrick, our program analyst for the Innovation Zones, will now direct the questions participants submitted via the chat box to our panelists. Renee?
Thanks, Edna, and thanks for those joining the webinar today and for our Innovation Zone presenters. I want to invite you to type your questions into the question box, and let's go ahead and take a look at some of the questions we received so far. Okay, we had a question, just wanting to clarify for everybody what child find is. I know for some folks on the webinar today that might be something new. So we did share some additional resources on child find, and I wanted to see if I could maybe ask Susan if you could share maybe a few words about what child find is.
Yes, sorry, I was muted.
No problem.
So Child Find is a program that tries to identify children. It's a state requirement. Funds go to local school districts to conduct community screening events and identify children who might need services. And it's a requirement by the law. And the way we talk about it as all screening kind of falls under Child Find. But in reality, everyone seems, the parents, the public seems to identify pre-K's doing a screening or Head Start's doing a screening. They're not as familiar with the term Child Find. What we do is once the children are screened, we would fill out a report form and submit it to the Child and Family Connections office in our area, which is responsible for collecting that data. I hope that's enough.
That's great. Thanks, Susan. And one other question we have from a participant. They're wondering about the CFC data collection form where providers report screenings to the LIC. They're interested, how did you get the centers to use this form?
Me again?
Yes.
Okay. So we showed it to them, and again, it was a surprise. They'd never acted like they'd ever seen it before. And we feature that part of it during our screening training when we go out to visit the centers and show them how they can fill it out easily, explain what the purpose is, and they can do that online, of course, or they can fax it or they can mail it. We teach them old school, and if they're tech savvy, they can figure out the others as well. I will tell you that there's a link. If you look at Child Find, put that in your search engine, you should be able to get that, IDEA /IL.US. So that's another way you can get that. And the purpose of that form, let me tell you, the purpose is to track the children that are needing referrals and making sure that there's some follow-up.
Great. Thanks so much, Susan. I know that we have someone on our webinar from Child and Family Connections that has some resources and some great information about some of the things related to our webinar today. So maybe we can follow up with you afterwards. I wanted to see if I could ask a question to Leah. I know that Janice had to jump off the webinar, but there was a question about how there in Greater East St. Louis, how they went about finding data, what sort of data they used. I wonder if you could respond to that.
Sure. So some of the data that they used was from ICAM. So that's the Illinois Early Childhood Asset Map run out of the University of Illinois. So that's a public database with just loads of information that any community can access. They have high-risk data. They can give you information both on a town level, on a county level, and municipality, depending on what the need is. They also use the Head Start Community Needs Assessment. They worked with some data from the CCR&R, and then they also used the Art of Hosting facilitation method to gather information from experiences, sort of the qualitative information piece during the deep dive, to get more information about people's experiences with the system and where they might like to go. So they had about, I think it was about 30 people who attended those initial meetings, and then they've continued to gather information kind of one-on-one from families.
That's great. Thank you.
Thank you.
I want to invite anyone else to submit any questions you have through the question box. I know we're nearing the end of our webinar, and I just wanted to remind everyone we will send out a recording of the webinar, and you will have access to the presenters' contact information again in case you have any specific questions. Great. I don't see any other questions coming in, but I want to thank everyone, and I'm going to turn it back over to Edna.
Thanks again to everybody on behalf of the Consortium for Community Systems Development. We appreciate the presenters and our participants for joining us on today's webinar. We will be posting, as Renee said, a recording of today's webinar on our Partner Plan Act website. We'd like to also invite you for our final Innovation Zone webinar scheduled on Thursday, January 14th, focusing on quality and the strategies for improving early childhood programs. If you have additional questions, please feel free to send an email to partnerplanact@actforchildren.org. Thank you.